Hi, I'm Rich Chalowski for New Lenox Cable Channel 6. I'm here at the Your Light Still Shines event here over at Lincoln Way West, and I'm joined here with John Roberts, president of the Hero Foundation. John, can you tell us a little bit about Hero and what brings you here today?
Well, HERO stands for the Heroin Epidemic Relief Organization. And Rich, we're here. This is Your Light Still Shines. It's a memorial for all those we've lost to a drug overdose this year, or in any year, actually. International Overdose Awareness Day is on August 31st. And in our case, we did it a little bit early, but all across Metro Chicago, all across this planet Earth, there's going to be a lot of organizations doing like we are today. We're trying to make people aware just how bad this epidemic is in our nation. I'm most interested with the United States and our losses, but we've lost almost 800,000 people in this century alone to drug overdose, and up until this 2018, the numbers kept climbing and climbing and climbing. The good news is last year, for the first time since the 90s, the number of overdose deaths finally started to drop a little bit, and we're hoping that's a sign and a trend. I mean, I've devoted 10 years of my life with Hero, and along with my partner Brian Kirk, who also lost a son. We both lost sons to a drug overdose in 2009. We've been fighting this war and hoping, just hoping, that we would see this type of data finally start coming in. When Billy and Matt died, our two boys, in 2009, there were about 24,000, 25,000 deaths that year in the United States. So it sounds bizarre, but last year when only 70,000 people died and it had dropped 2,000 deaths, I mean, that to me that was important because I fought for 10 years to see those numbers go down. The war on drugs, with that type of news breaking, I've been saying for years we're losing the war on drugs. Well, that was the first sign we're starting to win. And it takes things like this and people like that out here telling our community there's a serious problem. We have to fight to save our kids because we're just losing too many people. The deaths, that's terrible anytime, 70,000 deaths, but there's about 20 to 22 million people in this nation right now that require drug treatment, according to the best estimates. So, we have a serious problem, and I've pledged I'm going to fight this battle until I join my little boy in heaven. There's a lot of work to do, and we are going to win this war on drugs, whatever it takes. We have to. We can't lose any more kids. So we're out here today with our trailer. That's in the backdrop. I'm sure people will ask, what is that? But that's called the Hidden in Plain Sight trailer, and that's our adult education. We've had thousands of parents tour our trailer where we teach them what to look for in the way of danger signs that your kids may be getting involved in substance abuse. And the idea is for them to know how bad the problem is, but more importantly, to recognize their vitally important role as a parent. They have to get involved with their kids, stay involved, watch for trouble signs, and then pray. Pray that, their children don't get tempted by somebody else at school. That's what happened to my son, and yours too. I mean, you get tempted by somebody, and in a weak moment, you try something, and unfortunately, it can be the road to ruin, and it is for so many people. So I think we can, in this great nation, we can win this war. I'm going to keep fighting. I'm not going to give up.
Well, that's good. Can you tell us about some of the programs that Hero offers?
We have several programs we developed over the years. The first one is grief support. We meet every Tuesday night at Calvary Church at 16100 104th Avenue. The first and third Tuesday of every month at 7 o'clock. We have a grief counselor that we hire it's there to help families move through their grief. And we've had families that have been attending for years, and that's just how painful it is to lose someone. Here in New Lenox, we have meetings every Tuesday night at Lincoln Way Christian Church. They start at 7 and go until 8:30. But we also have simultaneously, and this started a few years ago, Heroin Anonymous also is working out of New Lenox at Lincoln Way Church. So the beauty of it is families can come to our group for family support, where we help them to know and understand the disease of addiction and what they can do to help. And at the same time, their loved one is in the next room with the Heroin Anonymous group trying to remain abstinent. And so those are two of them, but we have the trailer I mentioned. Naloxone is a opioid overdose antidote. And I've seen it work. It works within 2 to 3 minutes. And HERO had been training for years. Well, now we're recognized by the state. It's part of the DOP program, Drug Overdose Prevention Program. But our first full year was the end of 2018, and we had trained about 500 people. And more importantly, we gave out just about as many naloxone kits, and those things range in cost from $75 up to $490. But people have donated very generously and kindly to help us do our work. So that program is purely life-saving. Last year, we did the training here along with Will County, and within 36 hours, one of the local community emergency response team members from New Lenox saved a life. He saw somebody in distress in a local park. He stopped. He was having an overdose. He saved that life. So that's one of our really important programs. And one that I'm really excited about that we also kicked into high gear last year is we're going into the schools now on a regular basis. Last year, HERO visited 37 schools, middle schools and high schools, universities, but anywhere we're invited, we go. So that's about one a week during the school year. Spoke to several thousand kids, faculty, staff, and parents. And we just tell them our story, but drug education. So that motivated me. This previous Monday, I met with Senator Patrick McGuire. He's an Illinois senator from the 43rd District. And I asked him, I gave him a package, and I said, I've written a law I would like to see get passed here in Illinois requiring mandatory drug education at every middle school and high school in the state. And the kids would attend every year they go through school as teenagers. Those are the most vulnerable years. Kids who start early with substance abuse and the early teens, and many of them do, those are the ones that become part of that 20 to 22 million people with a drug problem later or a substance abuse problem. So I think it's absolutely vital that we get into every school in this state. Every year that a teenager goes to school, he should be reminded about how dangerous it is. So I think we can do an awful lot, but those are some of our programs. And advocacy, that last one I mentioned, it's not real glamorous, but just think if I visited 37 schools. If we passed this law, HERO will have helped it. The programs get into several thousand Illinois schools. So we're out here fighting, and what we're fighting for is important, our kids.
Is there a website or a phone number? Who can I contact to become or get in touch if I needed to go to HERO?
The easiest way might be to go to the herofoundation.org. That's our website, and you can send us an email, and we will get back to you within 24 hours. But that's probably the easiest way to do it. And then you can also stop by and at our meetings at Lincoln Way Christian Church every Tuesday at 7 o'clock. We're there, and there's a board member there every meeting.
All right. Thanks. That's John Roberts from HERO. And thanks for what you're doing out there. I appreciate it.
Thank you, my friend.
All right.
Thank you for what you do.
Hi, I'm Liz here with Channel 6, and I'm here with Dan Martin. And what's your title now, Dan?
Safe Community Coordinator for the Village of New Lenox.
And why are we here today? Tell us a little bit about this event.
Today we're at Lincoln Way West High School for Your Light Still Shines. This is an event in support of International Overdose Awareness Day. So we have a lot of activities going on here today. Outside we have the HERO, which is the Heroin Epidemic Relief Organization. They have their Hidden in Plain Sight trailer here. Also outside we have the New Lenox Police Department's medication take back, so people will be disposing of unwanted medications today. Inside here in the atrium, we have over 30 organizations, everything that has to do with substance use, disorders, addiction, things like that. People can get a lot of great information out here. In the section behind us here, we have the memorial tables, which people can visit. Those are the tables that have been set up for those that have lost the battle with addiction and have passed away. Inside the auditorium from 5:30 to 6:30, we have Narcan training, which will be done by Dr. Burke from the Will County Executive's Office. And right now we have about 150 people that are trained in, will be trained in Narcan this evening. And then starting at 7 o'clock, we've got a wonderful panel of speakers that'll be enlightening everyone in attendance about what we're doing here in New Lenox and Will County with regard to the heroin epidemic.
Well, that's very cool. It looks like you're going to have a nice crowd, a lot of booths. Anything else you'd like the folks to know about this in general or tonight?
I think it's a great event. We just want to thank our sponsors. We had some wonderful sponsors that made this event possible. Of course, Lincoln Way School District for the use of the facility, all of our wonderful organizations that are participating, our speakers, and of course our Safe Community Coalition, our Poisoning by Prescription Drug Overdose and Substance Abuse Task Group have been planning this event basically since last year's event. It's a great event. This type of event saves lives, and in fact, last year's event, which was our inaugural event, 3 days after the event, someone that took the training, the Narcan training, actually saved a life. So that's what it's all about. It's just trying to save lives and bringing attention to the issues that go on in the community.
Well, thanks so much for all you do, Dan. Thank you.
Thank you.
Now I'm here with, what is your name?
My name is Rosa Gomez, and I am from the Will County Community Health Center from Joliet, of course. And we are here to promote our services that we have. We have the Community Health Center, which we have family health services, we have behavioral health services, and recently we have just opened a Vision for our clients who are there. We also enroll people in medical coverage. We see have an OB clinic. We have the adolescent clinic as well. So these are all our services that we have. Among those, we also have the WIC program. We have family health services that also offer the teen pregnancy, which is a teen resources that we have, and that's through Family Health Services. We have recently started open up the clinic Tuesdays and Wednesdays in the university area that we have over there. So we're expanding. We're hoping that by that opening our doors to a wider, we have more community coming to us that are in need, and that we can go ahead and assist them in either behavioral health, pregnancy, and like I said, and we also do medical coverage, Medicaid, which is what people know it at the Community Health Center. So this is us. Thank you.
So what do you do as far as overdose awareness or clinics or people to talk to?
Yes, we do have, my understanding is that we have a response 24 hours for first response for those that are in need through our behavioral health services. So that's what they do, is to go ahead and act, and then they go ahead and find them resources that they need to go ahead and get them the help that they need. Okay?
Well, thank you for coming today. We appreciate it.
Thank you so very much. Thank you for having us. Okay, and this is our second year coming back. Thank you.
Hi, now I'm here with,
Cherise Stillwell.
and what's the name of your organization?
I facilitate a family support group. It's called Families United Overcoming Addiction. And we meet in Plainfield at Community Christian Church on Tuesday nights. We have speakers. We do a lot of educational nights. We have a lot of resources. We network a lot. We connect people, give them options for detox treatment. Many people don't have insurance. So they're the ones that we kind of tend to have, the soft heart for and try to help as much as we can.
So do people register in advance for these Tuesday nights, or do they just show up?
Nope, it's open. It's open to anybody that's in recovery, anybody that's struggling, any family member, anybody a loved one. Anybody can come. I do have it in the newspaper. I post it all over Facebook. So our meetings vary. Sometimes we have 22 people, sometimes we have 47 people. If I have a speaker, which I'm this Tuesday night, we have a fabulous speaker, and his name is Nick Gore. He's going to share his story. And he actually was hopeless of the hopeless. Had nothing, family was gone, everything. And he really worked hard and rose above, and he's got a great job, and he's got a family and kids, and he's doing great. So that's hope, and that's what we have to bring to the families, that there is hope.
Well, thank you for coming today. Thank you so much for sharing.
Thank you. Thank you.
Hi, and now I'm here today with...
Officer Paul Simon, Community Policing and School Resource Officer for the New Lenox Police Department.
And who's your coworker?
This is our Cadet Sergeant, Sergeant Gabriella Gross.
She seems like she's doing a great job. What are you here today to talk to the folks about?
Two things. We have the Unwanted Medication Take-Back Program. So to be environmentally sound, we want people to dispose of their medications in a safe way. So we do collections there, and then we are able to dispose of it properly, as well as to promote our Second Chance program, which is part of the Safe Passage Network. Anyone who has any struggle with addiction of any kind may come to our department, turn in anything they may want to get rid of without any fear of repercussion or charge. Then we would hook them up with, we would connect them with an assessment group as part of the Safe Passage Network where they can receive an assessment and begin treatment.
And where are the assessments performed?
It's through Family Guidance, who are also represented here. They'd probably be better suited to explain it, but one of their main offices is out of Manteno. They do have an office in Joliet as well.
So that's a great service that you provide. Anything else you'd like the folks to know about what you do or why you're here today?
As far as today goes, just to let them know, do not give up hope. No matter what your addiction, no matter how helpless or hopeless you may feel, believe me, one day at a time, you can get through it. I've seen it happen for people. This is the place to be, but the help is out there, no matter who they are or what they struggle with.
Thank you for everything you do. Thank you very much. Hi, so tell me who you are and what organization you're representing today.
I'm Deborah Tomey, and I'm with the Wilmington Coalition. I'm their program director and coordinator.
And what's the organization?
The Wilmington Coalition for a Healthy Community.
And what does that organization do?
Well, we actually have a drug-free community grant, and we actually work with our 209U school district and with the community in helping fight substance abuse to help bring about change in the community with some of our social norms with drinking and any type of substance use, really. And then we also, spread out into the other communities as well and try to collaborate with anything that we can.
So if somebody feels like they need help, do they just reach out to your organization? Is there a place that they go to?
So typically we'll get a phone call or they'll reach out to our organization or they'll come to an event like this, and then we actually collaborate with a lot of organizations that can help them, such as different treatment organizations or AA or NA or whatever, and we refer them to those places.
Hi, what are your names and what's the organization you're here today promoting? You are?
My name is Caitlin Murray. I'm Catherine Schramm.
And what's the organization you're here representing today?
We are here representing the Will County Health Department and Community Health Center.
And what programs do you offer for people with addiction?
For people with addiction, we do have mental health, behavioral health services. We do also offer counseling and some physician treatment through our Community Health Center.
And do people just show up at the health department, or how do they reach out to you that they need help?
You can go on our website, willcountyhealth.org, willcountyhealth.org, and then we have all of our programs, hours, and phone numbers available on the website.
Is there a fee for your programs, or how does that work?
Some of our programs do have fees. Of course, we do accept insurance, Medicaid. If you are uninsured and paying out of pocket, a lot of our services are available on a sliding scale fee, and sometimes they can be free.
Okay, and where's the health department located exactly?
Our main location is located in Joliet, 501 Ella Avenue, ELLA. We also have locations in Bolingbrook as well as Monee.
Anything else you'd like the folks to know about your organization, why you're here today?
You want to take over? No. Oh, no, sorry. Sorry, yeah, no, that's everything.
Okay, well, thanks for all you do.
Thank you very much.
Hi, what's your organization and what's your name?
Hi, I'm with the Chicago High Intensity Drug Trafficking Area. My name is Vic Markowski. I'm a drug intelligence officer under the Overdose Response Strategy.
Okay, and what exactly does your organization do?
One of the many programs that we do in our fight against narcotics and our fight against overdoses is we're introducing a program called ODMAP, which is Overdose Detection Mapping Application Program. And what it is it's a free program to allow the near real-time surveillance of both fatal and non-fatal overdoses that occur within a geographical area.
And how do people like sign up for your program, or where do they go to get this help or information?
Our program is limited to governmental entities. That's for police, fire, EMS, hospitals, public health organizations, coroner's officers, and things of that nature. There's links available on the odmap.org website for them to go to and request agency access.
Okay, anything else you'd like the folks to know about you, your organization, the good work that you do?
Again, Chicago HIDTA is a program underneath the Office of National Drug Control Policy. It's been in existence since the 1990s, and the program that I operate under covers the entire state of Illinois.
Well, thanks for your good work. Thank you very much.
Thank you very much. Have a great evening.
Hi, what's your name and the name of your organization?
Stephanie Masika. I'm with University of Chicago Ingalls Memorial Behavioral Health.
And what programs are you here tonight
promoting?
We are promoting our behavioral health department, which encompasses 78 inpatient psychiatric beds for ages 12 all the way up, as well as 16 inpatient chemical dependency treatment beds. All of our outpatient programming for mental health and substance abuse.
So does insurance cover most of these programs? Are any of them self-pay? How do you get reimbursed for those?
All of our programs are reimbursed through insurance, Medicare and Medicaid as well. Private.
So you have inpatient services as well as outpatient services. Any specific programs that have been most successful on an outpatient basis?
Well, our substance abuse program just opened up in July, so we can't really speak for how successful that is because it's not even been open for a month yet, but we're working on building that right now.
Well, thanks for coming. Anything else you'd like the folks to know about Ingalls or anything else?
Not today, thank you.
Thanks for your good work. Thank you.